Hello, and welcome to the Pet Healer Podcast. This is your host, Dr. Mitzi Vargas, and today I found inspiration for this podcast on my American Association of Film Practitioner magazine. We have a really insightful article called Should We Be More Compassionate When We're Managing Feline Urolithiasis? And what that means, uroliths are basically bladder stones, or we can call it kidney stones, but we call it bladder stones. And cats being blocked or having urinary tract infections where the source is caused by crystals or stones is a very common condition. Male cats, especially, are at a big risk of being blocked. That means one of those uroliths, the little bladder stones, moves into the urethra and can block the passage of urine. And that is very critical because within 48 hours, you could have azotemia and a kidney failure. And, of course, if you remove the obstruction and you hydrate the animal and flush all those toxins away, they do recover nicely. But occasionally, they reblocked within 10 days. Usually, those are the critical days. They can reblock. And if they reblock multiple times, they usually then there is a very radical surgery called perineal arthrostomy, in which the urethra is cut very short at the base of the pelvic inlet. And of course, you have a shorter time to travel from the uroliths if you cannot. Basically, that's a salvage procedure. You alter the whole lower urinary tract anatomy. And people joke you convert the dogs into the male cats, into female cats, but it's not really true. We're just doing the urethra, amputating the penis, and cutting the urethra a lot shorter. That is very radical, right? Those surgeries are radical. They don't come without complications, and with a life aftercare, life of chronic, upper or urinary tract infections because of the alteration of that whole anatomy. And so one of the things that we needed in this was a compassionate article in a way, because it's asking ourselves, asking the profession, what are we doing? Is there a better way? And actually, there are many good studies that have been demonstrating that, in fact, especially with struvites, which is a ammonium phosphate bladder stones, that there is 100% resolution of the cases using medical management, meaning using specific diet to dissolve those crystals and antibiotics if needed. 100% resolution of this problem. And so that's really insightful, because I knew that we could do it in female cats with no problems, because rarely do they get blocked. But with the male cats, I always had this in my head, that thought that, surgical intervention will probably be less costly and it will be quicker resolution. Well, there are 6 big studies that evaluate the medical dissolution of struvites versus, medical versus surgical. In all these studies, they say that medical dissolution is a very good path because it's less expensive, less possibilities of any problems or complications, and there's no surgery involved, which is very costly for some. So definitely, that to me was a new idea, because for many years we have been advocating to switch from dry to just canned food, thinking that it would be more hydrating, which it is usually. But when it comes to the solution of these struvite crystals, it doesn't matter. So if your cat will not accept the canned food, that's okay. You're not doing anything wrong. It will take the same amount of time. They said that the dissolution happened in as little as 6 weeks. That's significant. Another thing that is important to think about is that by changing the diet, you are all actually preventing this from reoccurrence. Where sometimes when they do the perineal ureterostomy, the people kind of like have this false sense of security that the cat cannot be blocked again. And so they change whatever diet they want. And so that's not really, we're missing the point. Now, can acupuncture help a blocked cat? Absolutely. In fact, when they come here and they're not totally blocked, we often utilize some acupuncture points to relieve the inflammation. And even if we are surgically intervening by passing a catheter, for example, there are many points, bladder 39, bladder 35, I usually bleed the bladder meridian to move the excess on the bladder meridian. Those points are really interesting and good. CV3, which is the alarm point for the bladder. All of these points you can use, absolutely. And you can use it in conjunction. And some people that are only TCVM practitioners have done that and successfully managed to decompress or deobstruct the cat. But I'm integrative medicine, so I usually use both. So these are, again, there are 6 major struvates. They were about 10,000 submissions for these studies. So they're not teeny tiny studies. They are big. And so they really also gave us an idea that the struvate increases, the ability to create these bladder stones increases with age. So it behooves us to have a way to prevent them. Crystal stone formula is another option. In those cases, in the cats refuse to absolutely eat the food, we will try to use a low residue food with low phosphate or ammonium in it, and something that is at least very similar to a medical dissolution diet, and then, or just plain meat, and then put them on the crystal stone formula, and we see similar results. I think in my personal clinic studies or experiential knowledge, it takes about 3 months for complete dissolutions on most of the stones using crystal stone formula, but it is effective. So one of the things that we need to think about it is constant surveillance of your male cats specifically, making sure that they go to the bathroom. If you're a cat owner, that's one of the things that you should endeavor is to make sure you keep an eye on that, and the amount and the size of the urine outputs that you count when you clean the litter box. And of course, cleaning the litter box should be a daily, if not every other day, endeavor. That way you can catch things very quickly. There's many litters, like the perfect litter in, the best litter in the world, I think is the marketing for it, that they have indicators in the litter for blood or for protein. So multiple indicators in the litter itself where you can actually monitor if your cat has already been blocked once. I definitely recommend the medicated dissolution diets for life. I definitely recommend crystal stone formula for the acute cases when there is medical management of them. And then I will recommend to always monitor and surveil the output of the urine on your cats. I hope that this was helpful for all our cat lovers out there, and for our fellow veterinarians. We just need to look at it. Sometimes some people elect euthanasia for these cases, and here we are, 3 to 6 weeks. We could definitely put the cat on a specific dissolution diet and take care of the problem at a fraction of the cost. So it behooves us to be more compassionate. I agree with the article 100%, and to offer these holistic solutions instead of being so reactive and jump to surgery immediately. Until the next episode, Stay well.